So this project started off with an email from Dr. Dan Golden at the University of Chicago Medicine. He's a radiation oncologist there, and he works out of the clinic in New Lenox. He wanted to explore the idea of using graphical narratives in educating the patients who are going through radiation treatment.
Often in medicine, the doctors and nurses say, here's what we think patients need to know, and they make a discussion guide or pamphlet or handout, but it's maybe too high of a level for the patients. It may not address what patients want to know or need to know. And so having a comprehensive design team come in, really assess the problem from lots of different angles, and then develop the final product was a really neat collaboration from a medical education standpoint.
We went to the clinic that Dr. Golden works at, and we got to, lay down on the bed that patients lay down on to get radiation treatment. We had face masks made and body molds made, which are things that some patients need to get to use during treatment. And having that kind of immersive experience was really helpful in understanding the whole process. We also talked to a lot of patients, caregivers, doctors, nurses, radiation therapists, social workers, everyone that a patient might come into contact with during treatment to try to understand that journey and what a patient needed to know.
We have all of this content, we have all of these visuals, but how do we fit it on one piece of paper?
Now with the discussion guide, I actually have graphical images that I can show the patient step by step who they're going to meet, what types of machines they'll be on. When we say we're going to make a treatment mold, we can actually show them a graphic image and say, here's a patient, example patient laying in the treatment mold. And so I've had patients, very clearly nod their head and understanding, oh, okay, now I see what you're talking about. I've also had patients flip through the guide while I'm talking to them and say, wait, so you're talking about this right here. And you can really see that the visual cue for a lot of these folks is very helpful as opposed to just a verbal discussion.
When you come and see your radiologist for the first time, you are so overwhelmed with all of the information that they give you. It really helped me out a lot. It even tells you aftercare. It tells you before. It tells you what to expect after you're done with your treatment. It was beneficial for me.
I envision it changing the standard of how patients are counseled about radiation treatment nationally.
Definitely in the beginning, I looked at it almost every other day because you just want to understand what you're about to go through.